A Primary Children's Hospital had an Ebola scare today. A patient came in with symptoms similar to Ebola, and that patient had traveled to a part of Africa that does not have the outbreak. In the end, doctors say it is, quote, highly unlikely it is the deadly virus. Eyewitness News reporter Christina Jensen is live outside Eastern Idaho Regional Medical Center in Idaho Falls. And Christina, since this scare, it's close to home, yes, but how are our local hospitals preparing for something like this?
Well, Todd, ERMAC conducts disaster drills to prepare for situations like this. And during those drills, they learn if they have the proper communication skills, right amount of medical staff, and proper medical equipment. Today, the news of a potential Ebola case in Salt Lake City is causing concern throughout our region. But Primary Children's Hospital in Salt Lake City says not to worry.
And it became clear to us that the possibility of Ebola infection was extremely remote. However, we chose to proceed as if it were a more high-risk situation so that we could fully exercise and test our system for responding for a patient with a possible Ebola exposure.
Meanwhile, Eastern Idaho Regional Medical Center also has a system and plan in place if Ebola were to pop up here.
If a CDC sample came back positive, then first of all, a patient would already be in an isolation setting if we suspected it. And so then if there's a positive sample, then there are a number of triggers, including CDC involvement from there.
Eastern Idaho Public Health District is also taking steps to prepare for this deadly virus. The agency sent a health alert to physicians in our area, encouraging them to ask patients of their travel history.
Probably the main things they're going to look out for is they want to know if anyone has visited those countries involved in the Ebola outbreak in West Africa. And if they have a fever of 101.5 or greater, and other symptoms such as headache, muscle aches, vomiting, diarrhea, things like that.
But as of now, local health officials say there is no reason for people to be alarmed. It is very difficult to contract the Ebola virus. It is not an airborne virus. It can only be transmitted through bodily fluids. Reporting live in Idaho Falls, I'm Christina Jensen. Todd.
Okay, Christina, thanks. Now.